I remember the baby being taken away, and I saw something rather unusual, but I wasn't quite sure what I had seen, and they had taken Winston over to the side, and the nurse walked over to me and she said, "You know, they can do a lot for children like this these days." And I'm still thinking, well, what is it? What is it?
I didn't have a clue what this was, and when he cried, I can see down inside the back of his throat, like in the back of his head. To me, it kind of looked like I was very scared because I thought maybe there was nothing in there. So it was very scary for me.
And I said, no, 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 that's not the situation. Being a nurse, I certainly had seen this before.
My name is Winston Permanand. I'm 27 years old. I have graduated from U of W with my arts degree. I want to teach kindergarten because I really I enjoy being with kids and hanging out with kids and helping kids to learn different things. I work just under full-time at Carter Daycare, and then I also work at Assiniboine Castle Daycare in the school age program at Laidlaw School. And then I also work at a gas station, the Co-op gas station in Charleswood. I've worked there for actually about 8 years now.
Cleft lip, cleft palate defect affects 1 in 750 live births in Manitoba, and it involves a spectrum of disorders ranging from just a little line on the lip to part of the upper lip missing, to part of the upper lip and the palate missing, all the way back to the throat. And it can be a very mild defect or a very severe one, affecting speech, eating, drinking, and appearance.
The cleft lip occurs already during the 6th to 8th week of a woman's pregnancy, where for some reason the pieces of the face have not fused together the way they normally should.
And the causes of cleft lip and cleft palate are not totally understood. We usually refer to it as multifactorial. In other words, a whole bunch of different things coming together causing a cleft. But it's the most common birth defect.
But it's still very traumatic because it's not the normal end to a healthy, happy pregnancy.
But I came home after that. I remember coming home, and I was supposed to call everybody to tell them about the kid that was born, because that's the normal thing you do. You phone family and friends, and I didn't know what I would do at that point. So I didn't phone anybody until after supper that evening, when I kind of dealt with it on my own and realized that, okay, it doesn't matter what it is, we're going to do the best we can for him, and we're going to do the best we can with the situation. And as far as I was concerned, I dealt with the situation in that day.
I didn't deal with my grief and loss over that until about a month later, when we went back to see the plastic surgeon who we had been introduced to in the hospital. And he said to us, "You know, Mr. and Mrs. Permanand, this is a drastic unilateral cleft lip and palate." And the word drastic was like it hit me in the face. And he said it'll certainly take several surgeries over the years to correct this. And I cried all the way home, and Badge is looking over at me thinking, well, didn't we deal with this ages ago already? We had to be innovative with how we fed him. What we did was make a huge cross cut in the top like this, and then he compressed this between the...
Yeah, and when he pressed this part here with his tongue, this opens, and the milk leak into his mouth.
Yeah, basically, because he couldn't suck, of course.
This is the little straight jacket that he wore, and the reason why they would put this on him is so that after surgery he shouldn't scratch the surgery or put his hand in his mouth. So they would put these tongue blades inside these space here, and that will keep this stiff, like this side. How this side is stiff, it can't move. So his hand will stay out like this all the time.
It's really hard for a parent to see their child with stiff arms like this. And
with a little toy, with a little toy in his arm, but he can't get the toy close to him.
yeah.
So it was kind of sad to see, because the kid wants to get the toy and to the mouth.
When Winston was about 4, they had developed plastic arm covers with a soft lining. And they served the same purpose, but it didn't look quite as bad because it wasn't like he was in this straitjacket kind of thing. And we were close to losing him when he was 2 years old, actually.
I remember holding him in a waiting room because he couldn't lie down because it was bleeding too much, and we just waited in that room there for a while. They were trying to figure out what they can do, and we were trying to comfort him. So he was sitting on me very quiet for a while, and all of a sudden when I moved, he just vomited, and it was all blood from what he had swallowed. So then they got really worried when he lose that amount of blood. They got really worried, and they start phoning somewhere in the States and different places. We can hear. We were in a room. They maybe didn't know we were hearing, but we can hear that they were trying to figure out who to call, where to call, and what information to get for this bleeding, because then they realized this is a big problem.
Later on, we learned that he had a bleeding disorder. It means that there's a prolonged bleeding time.
It didn't complicate dentistry that much, but certainly when he came to surgery, special precautions had to take place.
There might have been stuff that was raised at school or whatever. If he ever fell or anything like that, there was always the mad rush to get him either to the school nurse or back home right away. But he wasn't. We didn't treat him like glass or anything, as kids generally don't tend to do.
I've had many different doctors and nurses who have helped me in many different ways.
There's a plastic surgeon, an oral surgeon, an orthodontist, myself a pediatric dentist, speech pathologist, pediatrician, psychologist, psychiatrist, social worker, and on and on and on. Anybody that's required becomes a team member, and a geneticist is another one.
I had so many by the time I was 11 that they kind of run together, and I don't know exactly which ones were which.
In the early years, I think he actually liked the attention, didn't mind the hospital, other than he absolutely, to this day, cannot tolerate Jell-O and Kool-Aid drinks, which he received in such abundance because after surgery he could only drink clear fluids. He was born in 1979, and because of all the bleeds he had experienced, he'd had a lot of blood products and cryoprecipitate, and it was not a very good day when we received a letter in the mail saying that Winston was considered high risk to have contracted, perhaps, the AIDS virus
Through blood products.
through blood products, and that they would ask us to come in for testing. It was a really awful 14 days waiting for the results, but we were very fortunate and consider ourselves very blessed that Winston did not acquire HIV, but the potential certainly had been there.
My sister, who is, I guess, around 6 years older than me, she would come bring her friends over and stuff, and she would be very protective of me and tell her friends that he may look a little different, but he's still my little brother and he's perfectly normal.
Because we all sort of grew up together, it was never really an issue. It was always just sort of, he was different. He had a good sense of humor about it, so he was always cracking jokes. At school, it was a little bit different.
Jason came home from school and told us that he heard the bigger boys are calling Winston Crooked Nose.
So we said, so if it bothers you, what do you do when they tease you? And he said, I just keep on walking.
Yeah.
I've had 2 cosmetic surgeries or plastic surgery when I was 16 and 17, and they were mostly on my nose to try and make my nose seem less crooked, or the other one was to try and make my nostrils more similar to each other, because that was one nostril way off from a regular nostril. I could have more plastic surgery if I wanted, and at the time when I was about 18, I declined further surgery, plastic surgery, to correct anything else that they could do, and I'm okay with that decision still today. Overall, I would say it hasn't really affected too much. It might have made me a stronger person in a way, going through all the surgeries and stuff like that, and being made fun of a little bit has got to add something to my life.
Once you get to this age, I think 13 and 15 it might make a difference, but I think at 25 and 20 and that type of age, I think people are already past that, and they're looking for the person instead of, you know, their looks are not as much.
Winston also has a very pleasing personality. He's outgoing and he's friendly, and people kind of take to him naturally. And I think most people don't even notice the cleft, really. I never thought that the cleft lip and palate would make any difference into his ability to be a fully functioning young adult someday.
I gotta pay the bill somehow. Yeah.
The surgeries had to be done, and they were well done, and I think he looks pretty good. I'd probably have more concern about the haircut than I do about the cleft lip and palate as far as the appearance is concerned.
Can you explain your haircut
What do you mean?
for everyone watching?
What are you talking about? I don't got it.
Where did you get the idea for a mohawk?
Are you serious?
No.
Good. I was like, where else? Missed seat. In my room I have some miscellaneous collections, such as Mr. T here, also wearing a wig and a cowboy hat. And over here I also have a briefcase full of Mr. T paraphernalia that I keep handy.